I'm Meshal Malik and you're watching Indus Special. Every year on April 7th, World Health Day is observed. This year, the day comes amidst the worst health crisis of our lifetimes. Fear and panic has never been more palpable. But despite these unprecedented circumstances and the uncertainty that surrounds us all, thousands of healthcare workers around the world are at the front lines, risking their own health to make sure the rest of us are safe. The team of Indus Special wants to thank these individuals for their unmatchable service, which is nothing short of heroic. On today's show, we want to highlight their efforts and the cost at which they are performing their duties. Joining us for the discussion is Ms. Shannon Thomas, who is a certified trauma therapist and international best-selling author of Healing from Hidden Abuse. She joins us from Texas. Also joining us today is Dr. Syeda Huma, who's a senior medical officer working at the front line in the Corona Clinic at the Polyclinic Hospital in Islamabad. She joins us from Islamabad. Thank you both for taking out the time and for joining us. Dr. Huma, I'd like to begin with you. First of all, thank you so much for all that you are doing and all that your team is doing during these testing times. Now, talking about exactly how you and your team are dealing with this crisis, can you give us a sense of the enormity of the situation and how you guys are performing your duties?
We are 6 doctors in each shift. We are from different dispensaries and OPDs. Now the dispensaries and OPDs are closed, so all the doctors have been deputed to the shift of the emergency of polyclinic. We are working, you can say, fighting in 3 shifts, morning, evening, and night. 6 doctors are in each shift. But unfortunately, due to the closure of the dispensaries and OPDs, the rush of the emergency has been 4 to 5-fold. We are at the same time dealing with the emergency patients and with the corona patients and the general patients of OPDs. So we feel very, very much overloaded, and it is very, very much hectic.
Right. One can only imagine, of course, one can understand truly what this situation feels like for all the brave doctors and the healthcare workers at the front lines. But ma'am, talking a little more about how you guys are getting through this, I'd just like to move back a little and talk about the very nature of dealing with this pandemic. Now, 3 months ago, no one really knew what this was about, what this virus entailed. What kind of training was involved, if any at all, when you guys finally knew that the situation would come from being bad to worse?
Actually, we were given that basic training of, first of all, the awareness about the social distancing, hand washing, and keeping ourselves equipped with masks. But the kits which are provided in the casualties are, first of all, stuffed with gowns, gloves, face masks, and hand covers. So we need more these kits and protective measures for the medical fraternity, which are fighting in front line in the form of cleaners, nurses, doctors, and paramedics.
Right. That, of course, goes without saying that those who are there in order to protect us, in order to serve us during this testing time, need to be protected. That should be the first and foremost priority. Dr. Huma, please stay with me on that point. Shannon, now talking about this is not just the case we're seeing here. This is something that healthcare workers around the world are dealing with. The lack of protective equipment while they are at the front lines dealing with this enormous crisis. That, of course, causes multiple issues, not just in terms of physical health, but also the mental strain. Witnessing all these accounts, what do you think are some of the long-term outcomes that will last with these doctors if they're not protected at this point in time?
Yeah, that's a great question. We do know that post-traumatic stress disorder is often associated with traumatic events. It doesn't have to be one large event that happens in a lifetime. It can be something that is going over weeks and months, and that's what we're expecting to see, unfortunately, for many in the healthcare right on the front lines, is that they are going to show symptoms of a post-traumatic stress disorder on the other side of this pandemic because of the fact that they are living in a heightened state of adrenaline and cortisol levels that we know are going to impact them long term. Some of the things that we might be seeing are sleeplessness. Even now, we're seeing that folks are having a very difficult time when they're not on shift getting solid rest. We have to start with the body, the well-being, having them stay hydrated, avoiding dependency of any sort of caffeine or stimulants to stay going through these long shifts that they are having. We do know that the nervous system will be impacted by going to work and being exposed by not having the right protective gear to this virus and being in a chronic state of worry that will have a long-term effect.
Right. Of course, this will have a long-term effect, and it seems to be such an abysmal situation at this point in time when at every angle there is a struggle in dealing with what's happening. Dr. Huma, how are doctors at the front lines who have to continue performing their duties, how are they coping with this? Are there any ways, any words of advice that you could share with other healthcare workers?
Yeah, well, Meshal, I think this is the right time, and right question. When I was working in my casualty, dealing with the patients, I feel that the immunity goes down and it is disturbed with the stress when the stress goes up. And now, this for the fight for this pandemic, we need relaxation of mind and management of all the features, all the steps. While I will like to give one suggestion that to have a stress-free, it couldn't be totally stress-free, to calm down the rush in emergency while close all the OPDs of Islamabad and other Rawalpindi. We should reopen the dispensaries and OPDs so that general patients could be sought out there. And emergency and corona can be sought out in different clinics and could be directly referred to the corona isolation clinics and can be managed and tested or quarantined accordingly. So the stress would be much relieved if we will take this step in the management side. And the doctors, they are feeling very much involved, and they are human beings also. They are feeling fear also about their health and about their family health also. So we should take measures for the safety of doctors, paramedics, and nurses, and the medical fraternity first.
Right.
Then they would be able to relaxedly and strongly fight this battle.
Right. Sthannon, now I want to take this discussion back and forth. It's very difficult to find answers to the problems we're seeing, but we did a show earlier, a couple of weeks back, in which we talked about the mental health implications of what we are seeing right now, and we focused specifically on groups of people who are staying at home. Now, one of the main concerns that was echoed was, what about the healthcare workers working at the front lines and their families? Are there ways that they can process the grief they're seeing, process what they're seeing in a way that can, in any way, mitigate the long-term implications?
Absolutely. There are some things that can be done right now while we're right in the middle of this pandemic. And one of the things is watching the internal dialogue. As your other guest mentioned, that they are working in shifts. And it's very, very important that workers take those times off, take those shifts off, and really battle through some of the guilt that they might have that others are working or that there's patients that need them. When they have their shifts off, they do need to disconnect from this experience as best they can. Try to keep their home life as simple as possible when they are able to go home and not be on the front lines. Taking care of their physical body is very important. Normal hygiene, normal grooming, healthy snacks, maybe eating lightly while they're working so that they're not having a high digestion, so that the body isn't also going into trying to keep going and trying to process what's happening. Staying aware of what they can do. I think right now it's very overwhelming for both healthcare as well as mental health workers that are on the front lines of this as well.
Right.
Knowing what they cannot control. There's so much beyond their control. Connecting with healthy peers while the healthcare workers are at work. There's going to be a lot of folks that are, handling this in different ways. And so we want to connect with our peers that are resilient and handling these types of situations in the best way possible and not falling to the negative, the discussions that can be very draining. We also want to encourage healthcare workers to connect with their family as best they can. That's one of the things that we've noticed, that there's an isolating that's having to happen when the healthcare workers are also leaving their work. When they're going home, they're not able to hug their family. They're having to stay isolated. And so really working through ways to do self-care and comfort and other types of enjoyable, relaxing activities when they are off shift, when they are away from the clinics and the centers.
Right. Dr. Syeda, Huma, just one last question to you. Now, you mentioned one of the ways in which the government can help provide relief to the healthcare workers who are overwhelmed by the situation. But another thing is the fact that when your shift ends, you go back home, and that I'm sure brings with it a whole other sort of another entire level of anxieties. What are you taking with yourselves at home? How can healthcare workers be supported off shift as well? Are there any recommendations, anything that doctors within themselves are discussing that governments need to take a look at?
Yes, Meshal. I think that government should give an awareness training to the healthcare workers' families also. How to take care of the person who comes from the duty, this hectic duty, this pandemic duty.
Right.
So how to relax the person, how to hygiene the person, how to give nutritious diet to the person so that the person could cope with the responsibilities which have been given to the person and they have been devoted to it. So the healthcare worker as well as their families should also be involved about this training so that they can give a proper and appropriate environment for the health workers so that they can perform their duties well.
Right, that's a very essential and a very important recommendation. Thank you so much, Dr. Syeda, Huma, once again for taking out the time and talking to us, and good luck and prayers for your entire team. Sthannon, that is a point I want to continue off with. How can families be trained with awareness, and what can they do to cushion this trauma, to cushion what's happening? I mean, they worry, of course, their own anxieties are there about their loved ones, but when their loved ones do come home, how can they help them?
I think it's very important that when the healthcare workers come home, that the loved ones remember that this is not just a normal day at the hospital or the clinic or the center, that these times are extremely intense, and everybody knows that. But when our loved one has returned home, we often can fall back into patterns of, well, can you help with this? Or can you do this? Or this is the problem that was happening while the person was at work. And really, for families to buffer and realize that they are having another person, their loved one, come home from really what looks like a war zone in many situations, they are going to be extremely exhausted. They are going to be drained. They may be a little bit more edgy emotionally. And to, as a loved one, not take that on, but not walk on eggshells, but recognize also that their loved one has gone through a lot in a work day and in a work shift. much different from other years that this person has been out helping clients and helping patients. So minimizing the pressure that's put on these healthcare workers right now. One of the main things we want to be remembering is that this is going to end. We're already seeing some countries be able to do a few light restrictions, or they're starting to discuss that. We will come to an end of this. And so it's for a short season that we all have to work together, including the family members of healthcare workers and mental health care workers, that our loved ones will come home needing more support, maybe needing, like your other guest said, to rally around them, to help in different ways, and that we will return back to normal life where our loved ones who are healthcare workers will be able to contribute more once they get home. But that season is not right now. Right now, they really need to be cared for when they are at home with low demands.
Right. On that point, I'd also to introduce Professor Tim Devoogd, who is a professor of neuroscience at Cornell University. He joins us from New York. Professor Tim, thank you so much for taking out the time and talking to us. Now, the entire point of this segment is to get the viewers at large and also healthcare workers, but mainly the viewers, to appreciate and acknowledge everything, the type of trauma, the type of struggles our healthcare workers are going through at this point, to truly understand what they're giving up. Now, we've been talking about trauma, we've been talking about how that can be processed. Could you take us through how the subconscious mind would be impacted when a person is put at the front lines of something like this, what we're seeing right now, a pandemic?
Well, I think that something that's very important is to realize how afraid a person is, even though he or she is going in and doing this work that they're dedicated to. And it's a kind of fear, some of which is conscious, some of which, as you say, is probably unconscious. So they're having to fight through doing this every day. And frankly, that's exhausting. Frankly, separate from the hours they're working, separate from the physical things they're doing, that worry that's always with you is something that's going to be exhausting. And that's what they and their families should realize.
Right. That is something that they need to realize. They need to acknowledge that they will be feeling an influx of emotions at this point in time. That is integral to realize and to understand that they're human at the end of the day. Professor Tim, when we've been talking about this, what are some of the ways in which they can, you feel like, de-stress, or when they're at home, how can they process those emotions in a way that is easily digestible?
I think a piece of it is simply the understanding that this is going on. I think that if you can realize that feeling irritable at the end of the day, feeling tired at the end of the day is natural, I think it's easier to get through it. I think a second piece of it is that people should realize that they're in this for the long term, that it's not going to go away in 3 or 4 days, it's not going to go away in 3 or 4 weeks. And so I know people who are working in healthcare right now who start putting in 18-hour days. Well, in an acute emergency, you can do that. You can work for 3 or 4 days. You can work for a week where you're putting in 18-hour days, but you will start hurting yourself and your ability to help if you do that for longer. And so I think that they should say, yes, there's more work to do, but because this emergency is going to go on for a long time, at, I don't know what, at 15, 16 hours, I should go home, I should renew myself.
Right. Professor Tim, this is something that Sthannon also highlighted, in a sense, how essential those breaks, those off shifts are for these frontline healthcare workers who need to understand that they cannot feel guilty for not being there 24/7, that they do need that break. It's essential for their own well-being and their mental health. Sthannon, going back to something that you mentioned here was the mental healthcare workers, the therapists like yourself, the psychologists who are also grappling with this, who will also be overwhelmed with the type of responses, the type of patients, and the troubles they are facing. What are some of the things that they can do to help themselves?
Yeah, we have seen an influx of clients, old clients returning, new clients coming in. This has created a wave of anxiety. We're also going to see, as it goes on, as your other guest had mentioned, over the weeks and months, and it's not going to be a short end, we may start to see a highlight or a lifting of depression levels as well. So for mental health workers, we're employing the exact same techniques that we are recommending for healthcare workers, apart from the physical safety of being in contact with the patients that are fighting the virus. So for mental health workers, we are also needing to be patient with ourselves. We're needing to let our loved ones know, this is the type of day that I have had. This is where I'm at right now emotionally. One of the other things is that for mental health workers, not as much, but more for the healthcare workers, is engaging the senses. A lot of times the healthcare workers are needing to come home and not able to hug and interact in a close range with their loved ones. So engaging in sight, sound, smell, other touches, soft blankets, music, smells that are reassuring. Those can be wonderful ways to engage the neurological system and being able to really bring down some of those tension levels. And so for mental health workers as well, we're also asking our peers to take strong self-care measures in order to be able to do the marathon that is ahead of us, because we strongly believe that once this medical crisis has started to peak and wane, we're going to then see the mental health crisis that is on its way.
Right. Now, moving towards trying to wrap up this discussion, it can't be summarized in any way. We can't really fully try to justify any form of the anxieties, the types of struggles that all these healthcare workers are facing. Professor Tim, now this is a question specifically related to anxiety and the nervous system. Many people will be facing panic attacks, anxiety attacks. What can they do to help themselves in that situation?
I don't have anything new to say. They need to accept that this stress is coming. They need to know that having stress over a long period of time is damaging to you both mentally and physically. They need to use the resources they have, whether it be family or colleagues, as a way of knowing that they are accepted, they are loved, and that they are being valued for this huge contribution that they're making. If they accept that these bad things are going to happen to them, it'll make it easier to deal with them.
Right. I guess at this point, when we're talking about supporting our healthcare workers, it's important to stay at home, stay safe, do what you can as an individual, but also those families that have their loved ones going into the hospitals, going into the clinics, actually dealing with the situation. They themselves need to be aware of how they can help them when they return home, how they can help them ease their pain, ease their anxieties. Thank you so much, Sthannon, for all that you're doing for all the patients across the world. And Professor Tim, thank you both for joining us. We're going to go for a short break. When we return, we discuss what options countries are exploring to move forward once lockdowns are eased. Stay with us. Welcome back to the show. Now, countries, especially in Europe, are trying to find options as to how the lockdown can be eased to restore a sense of normalcy. One of the options being explored is that of issuing immunity passports. But what do these documents really mean? And could they potentially work? Let's discuss this further. Joining us for this discussion is Mr. Klaus Jurgens, who's an analyst and journalist who joins us from Austria. Also joining us today is Dr. Patrick Tang, who is the Division Chief of Pathology Sciences at Syeda Medicine, joining us from Qatar. Thank you both for joining us and welcome to the show. Mr. Jurgens, I'd like to begin with you. Now, before we jump to exactly what these immunity passports imply, Austria, where you're talking to us from, along with Denmark, is one of the first countries that have claimed they will ease the lockdown in the coming days. What exactly has led the government to believe that this is the time to start now easing a lockdown?
Hello, thanks for having me. Stay safe, everyone. Yes, I'm speaking from Austria, actually. So literally, I got caught up in all of this, but there's no reason to complain as long as someone stays safe and healthy. So we were self-isolating, and then the entire federal land of Tyrol went into quarantine over 3 years ago. Now, 3 weeks ago, oh my goodness, 3 weeks ago. Now, yesterday it was announced that due to a very, very positive development with regards to new infections, with regards to so unfortunately deceased people, the numbers went down. And what everyone said here, we have to wait at least for 2 weeks or 3 weeks to see whether numbers really go down, whether we had reached a peak, and whether everything was flattening. Now, it was announced that step by step a return to normal can be envisaged, but only under one condition. 3 communities in Tyrol remain under quarantine, but the rest of Tyrol has now the same legal basis, once again, same as the rest of Austria, and it is still absolutely mandatory to leave the house only for the most important reasons, which is work, shopping, helping someone else. But there is a huge difference now. Go to Innsbruck, and literally this morning, a number of parks and alleyways were opened again so that people can exercise, jogging or going by bike. But there's a big, big but. Chancellor Kurz said yesterday, it will only work if everyone sticks to the same social distancing regulations, at least for some more weeks to come. Don't meet other people. Don't run parties. Restaurants and bars and hotels stay closed until the 15th of May anyhow. But I think the move was based, Austria was one of the first countries to employ very drastic measures. Apparently, this lockdown has worked. I think other countries might take a look at Austria, how something the population initially, of course, no one would really appreciate. But then they said, this protects our life, this protects everyone's life. Yes.
Right. Mr. Jurgens, for giving us a sense of what is happening there in Austria and in Europe when they're talking about easing these restrictions. Dr. Patrick Tang, I want to get into exactly what are the implications of easing or making this lockdown more lax at this point in time. But let's talk about these immunity passports that have become quite controversial and have become the talk in terms of one of the policies that could possibly be adopted. What is the science behind these immunity passports, if any at all?
Well, I think in theory, these immunity passports or certificates are a good idea in theory, but there's so much still unknown about the virus and our immunity to the virus. So I think many of these calls for developing these passports are a little bit premature. So I think first, we don't really know how strong the immunity is after an infection. And we don't know how long that immunity lasts and whether it will protect us against a second infection somewhere down the road.
Right.
And also, we don't know how accurate the tests are. So there's like lots of tests on the market available right now, but we don't know which ones are the best. And we don't know if a positive result on one of these tests will predict that you will become immune to the virus. So I think a lot of the science is still being investigated.
Right, and since you mentioned it here and the fact that it's still not exactly decided and there isn't enough evidence to come towards a conclusion as to what immunity looks like after you have been infected and once you have recovered, can you take us what are some of the criteria, what are some of the ways in which data needs to be collected in order to come to a conclusion? What more bits of information are needed to actually get towards a picture that's whole?
We know from other similar viruses, from SARS and from other respiratory viruses, that people typically have immunity that lasts a few months, if not maybe even a year after your initial infection. So we base it on that. We have some evidence that most people should develop some immunity to it. But the thing is, we just haven't had the virus around for enough time yet. So the earliest people that were infected were back in November, December in China. So I think it'll be very important to watch what happens in China. Some of the early people that got infected, do they go on to have a second infection, and how long do those protective antibodies in their blood last? So that's very important, and I think we just need more time to find out some of these things.
Right. Time is, of course, the main central component of trying to figure out where things are going to be headed in the coming weeks, in the coming months even. Mr. Jurgens, moving back a little and talking about how most of the discussions regarding making the lockdown a little more relaxed are premised on the fact that people will abide by the law. Now, that is something governments would hope towards, but what we've been seeing is the spike was caused because people weren't taking the lockdown or weren't taking social distancing measures seriously enough. How are the governments optimistic that this will happen now in the future?
It's a very good point. I have a very brief viewpoint about the immunity passports in a minute. Now, I think it is a test for our societies. There were these shocking reports from some countries, people going sunbathing, the police had to stop them and saying this is a pandemic and no holiday. And please no one tell me that in the age of 24/7 news, even if you have no internet connection, your neighbors will have told you by listening to the evening news or buying a newspaper that there is a pandemic. So everyone is informed. And those defying these bans probably thought we are immune anyhow. It can never happen to us. But it is a very awkward, ludicrous attitude. There is no guarantee, Meshal. There is no guarantee that Denmark is loosening restrictions step by step. The Czech Republic announced it last night. Austria, other countries are not going that far as of yet. Now Norway has joined the rank. Yes, you have to trust your population up until a certain extent. It is 1% Russian roulette, 99% foresight analysis. But, Meshal, there is no guarantee, honestly. And we would, however, have to say, if you continue with a lockdown for longer than 2 months or 3 months or 4 months, the impacts on social life, the economy, would be so drastic that governments simply have to make a decision at one point. But let us all hope that people listen to the government and saying, stay home, go only out for 4 reasons and keep to social distancing. But as I've said, there is no guarantee. One very brief point on the immunity passports, if I may. The German news report this morning said it is possible to test up to 100,000 people per day, theoretically, whether they had a virus and are immune by now, on the condition that this would mean the rules where they work would be lowered.
Mr. Jurgens, sorry to cut you off there, but that is a point I'm going to continue with Dr. Tang. Since we're running short on time, thank you so much for joining us and giving us your insight. Dr. Patrick Tang, now that is one of the reasons why we're talking about moving towards immunity passports, that research can be conducted, but not a lot. There are many different versions coming out in terms of how research will be conducted, what needs to be done. You told us that we need to wait and watch. Going back to something that Mr. Jurgens talked about was, can populations be trusted? Is it too early for governments to be putting out measures and possibilities of making the lockdown more relaxed? Do you feel like there needs to be more awareness and just taking things at a slower pace at this point?
The easing of the current public health restrictions are going to be different for every region. What's happening in every region is different, and the decisions that each government is going to make is going to be based on the data that they have locally. So if they see positive signs and they have the capacity in their healthcare system to deal with new cases, and they have the capacity in their laboratory system to test people for possible infection, then and they have low rates of it going on in the community, that might be a sign that they can start to gradually ease some of the restrictions.
But here's the problem that I see with this, that when countries take measures individually, given their national context, that will not take into consideration that this virus is a pandemic, that every country is almost interconnected in this domain? Do we need a more centralized form of decision-making on these matters? Do we need countries to come on board and have better coordination? I mean, when we look at the case of China, most of the infections that are being brought in are from people coming into China at this point in time. So when this happens, will we not come back to square one?
Well, I think different countries are at different stages of the pandemic, and we have quite a few travel restrictions. So flying from one country to another, there's often quite a few restrictions. And when people fly from one country to another, there's usually border controls where people can be identified and potentially put into quarantine if necessary. So I think there are measures to control inter-country travel. So I think countries do have the ability to make decisions on their own, because I don't think the situation in China is same as the situation in Europe or in the United States.
Right. Now, just back to something that you mentioned in regards to the testing and whether it's even reliable or accurate. What are some of the questions the medical community is raising about these testing kits? Is the data right now not clear enough because there are so many fraudulent testing kits?
One of the problems is that if you look on the internet, there's probably 100 different kinds of testing kits out there. So first of all, you have to pick a test that's very high quality and has regulatory approval. The next thing is these kits look for something called antibodies in our blood, which suggests that you've been exposed to the virus before. But it doesn't mean that those antibodies will protect you from a future infection. So there's some very specific studies that have to be done in research labs to look at some of these antibodies to see if they actually protect you from getting a second infection. So these studies are underway, and also the comparison studies between the different tests that are out there are also underway. They're not all the same.
Right. So all of this data still needs to be accumulated. A lot of testing still needs to be done. A lot of studies still needs to be done. Thank you so much, Dr. Patrick Tang, for your time and joining us. We're now joined by Imogen Payter, who currently works as a member for Parliament in Westminster. She is deputy chairman at Parliament Street, a leading parliamentary think tank, and also a local council candidate. She joins us from England. Thank you so much, Ms. Payter, for joining us, and welcome to the show. Now, just a couple of questions to you. This idea of an immunity passport was put forth by the UK Health Secretary, Matt Hancock. Now, with the turn of events, with the Prime Minister being in intensive care, have measures now, are they being reevaluated as to whether we should even be having discussions of what can be done as a next step to ease the lockdown?
Well, look, I think we've seen that the priority of the government is definitely to try and maintain the peak at the moment. I think immunity passports are something way down the track. The current levels of testing, I mean, within the hospital, they're about 95% accurate. So to roll this out on a scale to test hundreds of thousands of people, it's just going to result in too many false tests. We saw the other day the government had ordered in 1.75 million antibody tests, and while these tests were tested on small numbers of people, the government has said we can't ethically use these to have a reliable result for immunity passports.
Right. Can you also give us an update as to what is happening in terms of the Prime Minister, Boris Johnson, and what is the climate like at this point in time in Britain? What are the conversations that are being had regarding the lockdown, and what measures are going to be taken now?
Yeah, well, look, I mean, unfortunately, it has been known that Boris was taken to hospital on Sunday. He's at St Thomas's Hospital currently with persistent symptoms of coronavirus. And unfortunately, he has now been admitted into the intensive care unit. We have heard that he is receiving excellent care, and we thank the NHS for their work. And the Foreign Secretary, Dominic Raab, he has been deputised where necessary. But I think the current situation is people are in lockdown. We need to take this lockdown seriously, and that is the way that we control the spread of this virus. Right. So that's the government's message, and that's what we're seeing happening around communities here. The other thing is just general hygiene. People need to be washing their hands. They need to be keeping social distance from people.
Right. Those are some of the important lessons that continue to be reiterated, that hygiene, maintaining those practices that all experts are saying are essential in order to protect yourself. They need to continue on a rolling basis. Thank you so much, Imogen, Payter, for joining us and giving us a quick update as to what is happening there in the UK. Thank you for watching Indus Special. We will be with you again tomorrow with more stories. Till then, goodbye and take care.